You need to keep paying your rent to keep a roof over your family's head. And in any home, you need to keep the lights on. But to do all of those things, you need money. And right now, you may not be rolling in enough dough because of the pandemic. But there are programs that are working to help keep you and your family in your home with the lights on. Rent and utility assistance programs are available in Guilford and Forsyth counties, as well as the cities of Greensboro and Winston-Salem. And we're talking about how you can get that help. So here are our experts from Winston-Salem, co-program manager Sharika Floyd, director of Forsyth County Department of Social Services, Victor Isler, community development analyst for Greensboro, Caitlin Bowers, and Randall Hoover, the division director of the Guilford County Department of Health and Human Services. So they're joining us today to answer your questions and make sure you know everything you need to apply for these programs. To get your questions answered, this is what you need to do. You need to text those questions. The number is on your screen right now, 336-379-5775. This is text only, so please do not call. All right, all programs are now up and running, so we're going to get an update on the numbers and where we are so you can see the broad scope of how many people are being helped. So first and foremost, let's start with the city of Greensboro. So Caitlin, kind of give us an idea of how long you guys have been up and running and what the numbers look like.
Since we launched 3 weeks ago on March 24th, we've received close to 3,000 applications and almost 1,000 submissions.
Okay,
those other 2,000 are pending additional information.
Gotcha. All right. And so there is still more money available so people can get those applications in. So let's go to the next city. So Sharika Floyd, you're with City of Winston-Salem. Now there is a rental and utilities. We're going to get to that with Victor. But Sharika, you have also a mortgage program specifically that I'm asking about. What are those numbers?
So right now for the mortgage program, we have 1,300 applications that have been started. We have about 900 applications that still have pending documentation. So far, we have 111 people who has applied for the mortgage assistance. So we're just urging everyone to turn in documents and submit required documentation to continue the process.
All right, two more things of numbers that we need to go through. Let's go to Guilford County. So Randall, you guys actually have been up and running longer than anybody else.
Yes, we started our program February 8th, so we're a few months into the process. We've received 817 applications thus far. We've processed 681 of those, with about 136 still in the process of being completed due to information that we need.
Mm-hmm. And more than $1 million spent already.
Yes, just under 1.1 million that we've spent so far.
Okay, and Victor, bring us up to speed on the joint Winston-Salem-Forsyth County application process that is for renters only.
So definitely at this point in time, we started on the 5th of April. And at this point in time, we have around 818 applications that have been submitted. However, of course, you know that they're at various stages because documentation has to be attached. And what I would say is the majority of those applications are still in progress and waiting for either the landlords or tenants to complete information. And so we're 2 weeks in, and definitely we are here and available.
Okay, so all of these programs, you will need documentation to make sure that you can apply and have all that documentation there so that you can be approved. But we want to make sure that you know that there is rental assistance with utilities and there is mortgage assistance with the utilities. So Greensboro has its own program for rent and utility assistance as well as mortgage. Winston-Salem-Forsyth County has a joint program for rental assistance. There's also one there in Winston-Salem for mortgage assistance. Guilford County has rent and utility assistance. All right, and so we wanted to be able to show you those so you knew who you needed to apply with. And so this is one of our first questions, and this is kind of like how this kind of goes. I applied for assistance in Guilford County. If I get some assistance from the county, can I still apply assistance from the Greensboro Fund? Caitlin?
No, if you received assistance and are eligible for Guilford County, you receive only funds and assistance through Guilford County.
Okay, and so we want to make sure that that's really clear. If you live in the city limits in Greensboro, you can only apply to the Greensboro program. If you live in the county limits there in Guilford County, you can only apply to the county. Now, Randall, this person is asking, what are the thresholds for Guilford County to qualify?
We would need proof of residency to show that you live where you say you're living. For the rental or the utility assistance, a rental statement, lease agreement, utility bills we would need if you're utility assistance, and we need some sort of income verification to show that there's been a financial hardship due to the pandemic.
It's springtime. It's time to start landscaping your yard, getting the garden ready. Digging in the yard seems relatively simple, right? Well, did you know that every 9 minutes an underground utility line is damaged? And when you start digging without knowing where utility lines are, yeah, that's what happens. You and your neighbors are sitting in the dark. That is why 811 offers its services for free for you. That's right, so that you can know where you can dig safely without causing any kind of damage. April is National Safe Digging Month, and we want you to be safe when you dig for all of those DIY projects. So with us right now is Howard Corey with North Carolina 811 to talk to us about how 811 can help you dig safely and keep you from taking off all those lights. We're taking your questions. You can get those questions to us by texting them to us, 336-379-5775. All right, so first and foremost, Howard, the question is 811, what is it? Is it free? How do we navigate 811?
Very good question. In fact, that was just scary what just happened, because that can actually happen. You know, I was sitting here watching my favorite news, WFMY News 2, and the lights went out and my TV went out. Unfortunately, that can happen if somebody decides to do their project around their house and not call 811 before they dig. So we at NC 811, we're the notification center. So for all the homeowners that are getting outside with the weather being so nice and they want to do their DIY projects, they need to call 811 before they dig, because they don't know what underground utilities may be in that area. So we serve as the communication link between them and the utilities in the area. So when they contact us by calling 811, we'll notify the member utilities in the area, and then they'll come out and mark those utilities. That's where you start to see the paint and flags starting to show up, and that's identifying what the utilities in that area. And so best thing you can do is just move away and stay away from them if at all possible. They'll send professional locators out and they'll locate them, and best of all, they'll do that for free.
We love that. We love free stuff. So to make sure that you don't have to pay more for your own DIY projects. All right, so some people are going to say, do I need to do this every time I dig in my yard, or is it something I should do when I have a fence or when I'm trying to do the invisible fence for my dog, or what?
Oh, that's a good question. Every time you dig, you need to call, because you don't know when a utility has come through and upgraded or installed a new facility that maybe you weren't home when they did it. So you never know what may be happening underground that you can't see. So we say, since it's a free call us every time we get ready to do that project.
Okay, right now we have a graphic up that says, how does 811 work? The first is notify, so that means, they're going to call you. And then it says wait. So how long is the wait time?
Very good. So you can call us by 811 is the easiest way to do it anywhere in North Carolina. And then the law says you have to wait 3 full business days. So if you contact us today, then you have to wait 3 full. So you wait Friday, Monday, Tuesday, you can go to work Wednesday. Weekends and holidays don't count. That 3-day window allows those utilities time to go out and get their facilities marked. So you'll know exactly where they are before you dig.
Right, because it takes some time to get those people out there to locate that. They've got to pull it up and figure out where all their lines are on your property.
Give you an example, in the area you're in Greensboro, they may have several hundred locates a day.
They do how many locations a day?
Several hundred.
Several hundred, okay.
Yes, so that, you're right, it takes them a few days to get around to all of those. So wait 3 full business days before you go to work. You'll start seeing the flags and paint show up in the yard. And then the next thing that happens is we'll tell you.
Hey, do you know what today is? Yes, it is Chinese New Year. That is not what we are talking about. It is the first day of tax filing season, and that means you are free to file. Or if you already have, the IRS will start processing your return. We know you have tax questions. We know you have questions about how your stimulus will be impacted. So we have 3 experts to get you answers. Mark Hensley from AARP North Carolina Triad Region, Kevin Robinson from Robinson Tax and Accounting, and Scott Braddock with Scott Braddock Financial. They are all your experts today to ask questions one-on-one. Here's how you do that. You text those questions, 336-379-5775. Again, this is text only. Do not call. Text only. Do not call. All right. So we've got our 3 experts here. What I want you to know first and foremost, in case you missed it, is that the IRS opened up tax filing season today. That means you can start filing your taxes now. As we know it right now, April 15th is still tax day. They did not move it like they moved it last year. April 15th is tax day. With your tax return in mind, Kevin, let's start out there. The IRS is really pushing people to e-file.
Yes, that's a very valid point, Tanya, and it's really it's the safest way to do it. And of course, we know that if people, the quicker that people can e-file, the quicker they can get their refund and get their tax filed, and also prevent identity theft and any mail delays. As we know, the mail system itself has had a lot of delays, so it's quicker, safer to e-file. You can get electronic acknowledgement usually within a few hours, so it is the way to go. And I know for me, it's the way I have to go. Since I'm paid for more than 10 returns, I have to e-file or file a form telling why I'm not doing it.
Okay, gotcha. All right, so e-filing is the way to go, and you can e-file for free. It is in the 2 Wants to Know section right now. We've got lots of links to help you. All right, next on the list, what you're going to be talking about is stimulus, as in stimulus number 3. So, Mark, where are we with stimulus number 3?
So as of just a few hours ago, the news looks really, really good. The Biden administration promised that every American would get an additional $1,400. Has been debated since they went into office in January, and now those are starting to really simmer down. And so it's looking like the proposal would mirror the last 2 stimulus packages, meaning that an individual with an adjusted gross income of $75,000 or less would get a $1,400 payment. Of course, if it's married filing jointly, that amount doubles to an adjusted gross income of $150,000. So it's looking very favorable. And Nancy Pelosi was quoted today as saying, if negotiations go as planned, they should be able to start processing payments out to Americans by the end of this month.
All right, so maybe by the end of this month, as in February, end of this month?
Yes. End of February.
Okay, we'll see what happens with that. In the meantime, one of the most common questions we get about the stimulus is, where is the stimulus money coming from? Are they taking it from our 401ks? Are they using my tax money for it? So, Scott, let's answer that.
Well, fortunately, they're not taking it from your 401k, and they're also not using our tax money because our country runs on a deficit. We spend more than what we take in. So here's an idea of what transpires here. So the Treasury Department, what they do once a bill is passed, like such a stimulus, is they're going to create debt instruments such as T-bills, notes, and bonds. And then their job is to sell those. They're going to sell those to ordinary investors, institutional investors, and then also sovereign governments. However, the big player here is the Federal Reserve. Now, they have a special option here where they can actually print money. Now, it's not printing money like you may think, where money's just flying off the printing press. That's not how it works today in the digital era. They're just simply going to put the numbers on the screen and transfer that money over to the Treasury and buy up a lot of those debt instruments. That in turn is going to show up on the asset balance sheet for the Federal Reserve. And that is really actually inflated over the last year. We're looking at close to $9 trillion. So just a side note here, the real concern moving forward is going to be inflation. The government needs to do a really good job and know when to taper back some of these support methods, such as the PPP loans, the Main Street loans, and of course, stimulus as well.
All right. So what we're going to do is we're going to start taking your questions coming up in the next segment. You can text us those questions, 336-379-5775. Already in the queue, we have, is my stimulus money taxed? Is the tax deadline extended? What happens if I got my last stimulus check in January instead of December? What year do I claim it on? We're going to answer all those questions and more coming up. The federal health insurance marketplace reopened this week for a special enrollment period to ensure that Americans in need of insurance coverage during this coronavirus pandemic have access to health care. We know that you're going to have questions about it, which is why we're going to help you get answers today. I'm joined by Dr. Catherine Sevier, president of AARP North Carolina, Morgan Campbell from Alliance Insurance Services, and Laura Packard from GetAmericaCovered.org. Now, here's what you do to ask a question. You text that question. The number is on your screen, 336-379-5775. This is a text only, do not call, but we do want to be able to answer your questions. All right, as I stand here in front of my guests, the first thing I want to do is put up the timetable. The open enrollment deadline used to be December, but now it is May 15th of this year. So the entire enrollment period for the Affordable Care Act deadline goes from now all the way until May 15th. All right, Morgan, so kind of like talk about what this means. What are the options?
So what this means is we now have a redo or a open enrollment 2.0, if you want to think of it that way. So if you missed open enrollment in November and December, now we have the opportunity to get you enrolled, change your plan if you need to change your plan. At any point, we can always update your income to make sure you're getting the correct tax credit. And, you know, we can do all of this in the next 90 days. It actually started yesterday and we're running till May the 15th.
All right, so there's 3 months here. All right, Laura, let's talk about what some of the legislation is and the provisions.
Well, right now, Congress is looking at a COVID relief bill that includes some key provisions that might help you with health insurance. One of those provisions would give tax credits to anybody if they're paying more than 8.5% of their income right now on their policies. So right now, maybe you make a little bit too much money to get help, but if this bill goes through, then it would be open to everybody, as well as some incentives for struggling families that don't make that much money. And North Carolina is one of the states that hasn't expanded Medicaid yet. So hundreds of thousands of North Carolinians could benefit from free or affordable health insurance if the North Carolina state legislature takes advantage of this new bill of the incentives and passes that too.
Okay, so today we are going to talk all about the ACA marketplace and how you get enrolled. We also are able to answer questions on Medicare, and that's where Dr. Catherine Sevier comes in. You know, one of the biggest questions we hear all the time is, do I really have to enroll in Medicare when I turn X amount of age?
Yes.
Explain yes. Why.
So age 65, as you approach your 65th birthday, 3 months before to 3 months after. So think of a total of 7 months where you need to sign up for Medicare. And even if you're still employed and have other insurance, you need to decide and look at all of the pieces you need to sign up for. Part B in particular, you either have to waive it or sign up for it. If you don't get it from the beginning, you will pay a penalty for the rest of your life, and the penalty grows from year to year.
Okay, and so that is a key point with Medicare. Yes, if you're still working at 65, yes, you enroll, and especially in Part B, otherwise you will be paying a penalty. All right, we have several questions, Medicare related and ACA related. This first one is an ACA question. It says, are they going to raise the subsidy anytime soon? And Laura, that's what you were talking about, yes?
Yes. And so pay attention, because this bill has not become law, but it or a version of it may get signed into law in the next few weeks, and it will take effect for this year. So in the middle of open enrollment, it could change how much tax credits you're eligible for.
All right, now Morgan, when we're talking about enrolling in healthcare, I know it's really complicated because there's all kinds of different plans that are out there. So if someone were to call an independent insurance agent like yourself, what kinds of questions should they be asking you?
Well, we would want to first start off with, how many dependents do you have? What are your health conditions? And then we want to know your doctor, because we need to look at all of those things and make sure we're selecting the right plan that's going to best fit your needs. It's not a one-size-fit-all option.
We are back, and we are joined by State Health and Human Service Secretary Dr. Mandy Cohen. Remember, you can text your questions. The number is at the bottom of your screen, and we will leave that up. This first question says, with such a shortage of vaccine, why can't the so-called recipe for the vaccine be given to other drug manufacturers?
What a great question, and it is very frustrating that supply of the vaccine is very low, and we are limited by what is coming from the federal government to the state of North Carolina. And I know the Biden administration is looking at the Defense Production Act, which allows them to use some of those tools to say, hey, why isn't everyone manufacturing vaccine and sort of giving the recipe, if you will, to others? It was talked about as recently as this morning on how they can do that. Now, those still takes weeks and months to turn those kinds of things on and get production lines going. But we know we're going to be vaccinating. This is a marathon, not a sprint. And so I think folks are looking at those kinds of solutions. Unfortunately, that's a federal decision. It's not something here, unfortunately, in North Carolina that we have a lot of control over. We just want to make sure that the vaccine we get out quickly and we get it out equitably.
Mm-hmm. Speaking of which, this next text question says, when do you expect more doses to become available?
Yeah, great question. Supply is incredibly limited right now, but we're getting a little bit more each and every week. Over the past 3 weeks, we've gotten about 5% more each and every week. So that's a good sign that there's more supply, but still, even with just 5% more each week is
Okay, so we're having a little bit of technical difficulty there. I'm seeing that her shot is frozen there. What I do want to do is, while we work on this and we seem to get that up and running, I want to give you that hotline number one more time so that you have that hotline number. She mentioned it. She read off the hotline number. This is one of those places that you can call and get your questions answered. But this is not a place that you can call to get an appointment. This is simply a number for you to call and have some of your questions answered, or to find out where is the closest place for you to be able to get your vaccine. And that number is 1-888-675-4567. Again, 1-888-675-4567. The other thing we want to go over is also something that we touched on briefly in that first segment, which is the email that you may be getting from the Department of Health and Human Services that talks about a portal. And the reason why you would be getting this specific email is because you have an appointment, and they are trying to just cut down on the time that it takes for you to get all of your information into the system. All right, with that said, it seems that we have all of our technical difficulties figured out, maybe. I see Dr. Cohen here. Let's see. Sorry about that. No worries. It's okay. It happens. All right, let's continue on with the questions. This person says, should you get the COVID shot if you do not have a normal immune system?
Oh, great question. So as I was mentioning before, there are almost zero contraindications, or meaning reasons to not get the vaccine. Again, I'd always talk about it with your doctor, with your healthcare provider, but we are encouraging everyone to get the vaccine. Even if you have had COVID before, you want to get the vaccine. Even if your immune system is weakened for whatever reason, you want to get the vaccine. So there's almost no medical reasons that folks are saying not to get the vaccine. I will say, for those women who are actively pregnant, that is a conversation you want to have. But again, no data to show that there's any concern there, but a conversation you may want to have with your obstetrician before getting the vaccine. But again, we're recommending it for everybody.
This person is asking, when the state moves on to the next group for vaccines, can people who are 65 and older still try to set an appointment if they miss their group setting?
Great question. We don't close groups, we do add. So those 65 and up will still be able to get vaccine from now until we keep vaccinating. So you won't lose your turn by us moving on, but then there'll be more folks in the queue and being interested in getting it. And so you will have frontline essential workers who are going to be making appointments at the same time, which is why we try to give priority to those who are 65 and up first, but you won't be locked out going forward.
Okay. This person is asking, what physically happens if you're unable to get your second vaccination?
Well, I would say we very much recommend you getting it the way these vaccines were intended, which is if you get the Pfizer vaccine, you want to get it 21 days after your first, or as close to it as possible. And for Moderna, 28 days after your first. So as close as possible is really what is recommended. Now, if you go past it, it is okay. You do not need to start over. Whenever you come back for your second shot, you can get that second shot and go on. But I would recommend everyone doing as close as possible, because again, we want our immune system to be as strong as possible from getting these vaccines, and that's what your second dose does. It helps your immune system get even stronger, make those antibodies that fight off this virus if you should come into contact with it.